So officially, hello, good morning, and welcome. Thank you so much for being here with us. We are on the third webinar of the Reimagining Prevention series, and today's presenters will be discussing the roadmap to comprehensive prevention planning, including an overview of the opt-in process, the comprehensive prevention planning process, the program block grant, the technical assistance, and so much more. My name is Jessica Matley. I'm a training coordinator and facilitator with a program that's funded by OCAP and the state called the California Training Institute, but our friends call us Caltrin, so we hope you do as well. I'll be talking more about our programs in just a minute, but this morning I'm here to kick off today's session, review some of the important notes and reminders before the webinar begins. So let's get going. Couple reminders and important notes. You might be asking, is this going to be recorded? Yes, it will. A replay of this session, as well as the previous two webinars in this series, can be found on either the Caltrin website or the Strategies TA website. To make it easy for you, we'll drop a link in the chat so that you can find that. If you are a note taker like me, and you want a copy of today's PowerPoint for your records like I do, then you can have a copy of that right now by clicking in the chat. You'll see that there's a PDF document that you can select and it will be in there for you. I will also be dropping, like I said, a link to the previous webinars. Now, a follow-up email is going to be sent in the next 3 days. That will have links, and more links, resources, where to find things that we talked about today, a copy of the PowerPoints again, and all the information that you need. So if you registered today, which you did, it will be sent to your registration email. And lastly, and most importantly, I'll say it more than once, I would love for you to take a moment to complete the survey at the end of this webinar. And I promise it's not a standard survey. It does have standard questions, but it's actually used to solicit your feedback. It's a temperature check of the areas where participants might want more information or support in the future. So I'm going to ask you to please fill it out. Now, I want to direct your attention to some of the interactive features of the webinar today. I know you're probably a seasoned Zoom user by now, so I'm not going to tell you where the chat box is, but instead I want to tell you the distinction between the chat box and the QA feature that we're going to be using today. If you have a question, if it is a question for any presenter or about the presentation, please use the Q&A feature. That Q&A box, which you can see on the screen with the green arrow, that Q&A is going to ensure that we can capture questions to answer at the end of this presentation. We'll have a short Q&A session at the end, but we also have a dedicated Q&A session just for today in April. In a few weeks, we'll drop the registration and all the information you need in the chat for that. So any questions, they have to go to the Q&A feature to be addressed. For other questions, maybe aha moments, if you'd like to drop those into the chat, you are more than welcome. But the Q&A, again, please direct questions to the Q&A feature. Our follow-up session will be on April 21st, and I'll be sharing more information about how to access that in just a few. All right, so now let's talk a little bit about this Reimagining Prevention series. I'm going to talk about the who, what, where, give you a little overview. This will take just a few moments, but it's an important note to make. Let me start at the beginning. So the vision here is to create an integrated statewide system to reach families sooner, to build strong local prevention networks to strengthen not only families, but communities and prevent child maltreatment and entry into child and family serving systems. So how do we do that? By building capacity of community partners, by joining with others around a common goal of child abuse and family well-being, and starting to look at the larger landscape of services being offered across private and public agencies. With this vision in mind, the Reimagining Prevention series was born. The goal of the series, this collection of webinars and events, is really to bring all the players of prevention work at different levels of prevention to the table to learn about key foundational principles of prevention and to start to reimagine the way that we are committing to, we're coordinating with, and we're investing in prevention work. And another goal of this series is for a diverse audience to come together to learn prevention principles such as utilizing an equity lens and engaging with community when developing, planning, and implementing prevention work. We began to explore this in our first webinar, which was called Equity and Community Voice as the Foundation. I hope you were there. If not, we can get you a replay on that site. And continued in the second webinar, which was called Structural Wellbeing with the Hayward Burns Institute. The thoughtfully curated topics in this series, this collection of webinars and other events, will provide information and ways for agencies to move upstream towards primary prevention to support and strengthen families. The ultimate goal is for all of us to work together to break down silos and to develop a comprehensive continuum of prevention services that includes primary, secondary, and tertiary strategies and interventions grounded in fairness and equity. Now, for the first time, federal legislation has provided state agencies the opportunity to leverage Title IV-E funds to shift to an upstream approach to serve children and families and to start thinking differently about when and how we engage with families and quality of services that we are delivering. So what does that look like at the state level, let's say? The state is currently planning for the implementation of the Family First Prevention Services Act Part 1, FFPSA, which is federal legislation that states can choose to opt into to deliver evidence-based services to individuals that are at imminent risk of entering into foster care. These services will be provided to families that are involved with child welfare and probation, but will keep the families intact and the children at home. California wanted to build upon the opportunity of this legislation and moved even more upstream, which is what brings us all together. This is what we're doing here in this webinar. So the Reimagining, just a few more notes about it. The Reimagining Prevention Series is centered on Assembly Bill 153, which builds upon the Family First Prevention Services Act, FFPSA, by offering additional funding and requires counties and their partners to develop a comprehensive plan that includes primary, secondary, and tertiary strategies. The development of this comprehensive plan will require change collaboration with community providers, other public agencies, tribes, individuals with lived experience, and other key partners. So this webinar today, and as well as all the others in the series, are a primer and a way for community partners and county agencies to start thinking about how their agency might fit into the larger goal of developing a comprehensive plan. We might say reimagining. So speaking of coming together, let me quickly review the partners involved in making this series happen. So on the screen, you'll see a couple of logos that you probably, and I hope, recognize. We have the California Department of Social Services, California Department of Healthcare Services, Strategies TA, and Caltrin. Now, we've been meeting regularly to discuss, plan, create this collection of topics and webinars in the Reimagining series. CDSS, just a quick overview, serves, aids, and protects needy and vulnerable children and adults. DHCS provides access to affordable, integrated, high-quality healthcare. Strategies TA provides technical assistance focused on building statewide long-term solutions. And Caltrin, who I'm representing today, provides free professional development and extended learning opportunities to professionals. That would primarily be staff of family resource centers, CAPCs, and other child and family serving organizations. So now that you've learned a little bit about us, a little bit about what we're doing here today, we'd love to take just a quick moment and learn a little bit about you. So what you'll see on the screen is a map. This map is of our great state, and you'll see it's broken into some different regions, color coordinated. So what I'm going to do is I'm going to launch a quick poll for us, and I'm curious to know, where are you joining from? What region are you in? So let me launch this really quickly. Okay, let's see. If you just select, whoa, okay, those are coming in fast. I feel like I'm watching a race because they are happening quickly. So it looks like we have representation from a little bit of everywhere. Let's see here. I'm giving people a chance to answer. We are at 72% participation. Let's see if we can get to 80. Oh, Massachusetts in the chat. How wonderful is that? Welcome. All right, so we have 80% participation. Thank you so much. I'm going to end this poll. And I'm going to share the results. Take a look at this. Can you see that? So it looks like we have some statewide representation, but we have people from all over. I can tell you because I saw the registration. I think in every county of this great state, we had some registered participants. So thank you for that. All right. So now that we have an idea of where we're joining from, my next question to you is, what do you do there? So what is your role? I'm going to launch a quick poll just to better understand, what is your role? We have a couple options: direct services, administrative, advocate, supervisor, manager, director. If you see something on there and you say, Jess, how about D, none of the above? Well, then you can put it in the chat. I would love to know. So, okay, great. So we have, it looks like we have people that are still answering, right? We're at 70% participation. I will end this in just a moment. Looks like we have some other options coming through the chat. Thank you for that. I really appreciate it. I will end this poll for us and share the results. What I love the most is that we are a diverse group here. So we have a little bit of, it looks like, direct services. We have quite a bit of administrative managers, director levels from all over the state. So that's very exciting. Now this last poll is a fun one for me. It's a little creative here. So think of it this way. We're talking about reimagining. We're talking about prevention planning. And today we're talking about the roadmap. So if we're thinking about this work as a roadmap, as a journey, if you will, let's pretend, let's put it in a form of an analogy. Since I obviously like talking about road trips, when it comes to the primary prevention journey that you're on, okay, this road trip, this primary prevention journey as we're moving upstream, where are you? So this is the question. Can you rate your county, not your agency, your county, on the current primary prevention efforts? If we were on a road trip, are you like at a 1? Like we are still trying to figure out where we're going. Are you at a 2, which is we're mapping it out, we're having an idea, we're planning our routes? Maybe you're at a 3, you're like packing up the car, making sure you didn't forget your snacks. 4 is you're on the road. You're like making your way there. It's that are we there yet moment. And 5 is you can see it on the horizon. You have turned the corner, you can see it, and you're getting close. And the last option is I'm not too sure. They are all great. They're all great. But where are you on this road trip prevention, primary prevention journey? I'm so curious. I can see that it's taking a little bit more for people to answer because you're thinking through the analogy. I appreciate that. Thank you for your thoughtfulness here. So we have, I think I'll close this poll out now. Great. And I'll share the results. So you can see we're a little bit in the middle. It looks like we are mostly in the number 2. So you might have an idea of where you're wanting to go with this, but maybe you're still mapping it out, and that's a good place to be. I think in this conversation, there'll be something for everybody as we discuss next steps and what the plan looks like. So thank you for that. I appreciate it. I also missed my opportunity to show you my great slide for that poll. And I specifically chose locations in California since some of us are coastal and some of us are not. So that was our road trip slide. Wonderful. So with that, I want to say thank you for spending some time with me in this introduction. I'd like to introduce our first presenter, Cheryl Treadwell, who is the branch chief of the Safety, Prevention, and Early Intervention branch with CDSS. Thank you so much.
Thank you, Jess, for setting that context on our journey here. Let's keep moving on, easing on down or up the road. So, as she said, I'm Cheryl Treadwell. I'm happy to be here today with this awesome panel. We're hoping that we will be presenting information that you will find useful. A couple of things before we get started that I want to say is that there are a few things on this webinar we will not be discussing, like Part 4 FFPSA. I know that there was some questions early on about whether or not we would be addressing any of those questions associated with STRTPs, QI, aftercare, wraparound. That is not this webinar. But we hope if there are connecting points to our presentation today, we'll make those clarifying distinctions. So let's go to the next slide and jump right in here. So today, I hope that you walk away with our objectives as making sure that you are able to connect California's implementation with the Federal Family First Prevention Services Act and how it is implemented, how it is connected to your comprehensive prevention planning process. We will be reviewing the requirements of what it takes to develop that comprehensive prevention plan, how that might be implemented as your local family prevention services program. And we hope that you will be able to understand and walk away with the tools you need to begin the comprehensive prevention planning process and the implementation process. And finally, we hope that you will learn how to access the additional support that the state is going to make available to you and the information that you will need to inform that comprehensive planning and implementation process. Before I proceed, I wanted to provide for you an update on where we are with our prevention plan. As you know, we have been engaged in a very robust stakeholder process. Starting back in February 2021, we started with a huge summit. That was a kickoff to begin the discussions related to prevention, Families First Prevention Services Planning. We introduced that at the Prevention Summit to kick off that direction. We conducted a host of surveys and had a host of targeted focus groups, regular stakeholder forums that we convened and were able to introduce the discussion around prevention services plans. And then we submitted our 5-year prevention services plan to ACF in August. We got some responses back in September, and in the meantime, in the fall of 21, we convened an advisory committee. We hosted several meetings there where we were able to socialize some of the responses that we received back from the federal government, and we obtained feedback on those responses. We engaged in other stakeholder review processes, tribal consultation, specifically working with our 4E tribes, our Yurok and Karuk tribes. And now we are heading toward the goal to try to resubmit our revised plan, hopefully in the month of May of this year. So why are we here? Jess has given us a great context earlier today of why we're here, but basically we want to provide information on the components that are relevant for the prevention aspects of AB 153. This includes looking at the required activities that counties must adhere to if they elect to opt into the use of the state block grant. The bill, as we know, does some of the following. It just indicates what California created in their legislative process to indicate how we have elected as a state into the FFPSA, what I call the Families First Prevention Services Act Part 1, in order for us to receive federal dollars for, as they say, the selected evidence-based, well-supported prevention services. We know that the bill authorizes all of the tribes, consortium of tribes and counties to enter an agreement with the state to provide those services. Tribes and counties can opt in and receive the state funds, which we are calling the block grant, and they must be able to submit to CDSS a comprehensive plan that outlines the continuum of the primary, secondary, and tertiary prevention services and intervention strategies. We hope that the legislation also outlines the continuum of services, that they have to be culturally appropriate and responsive services, that they must be tailored to meet the needs of families that are disproportionately represented in the child welfare system. So let's talk about vision on the next slide. This says, to support families to provide a safe, stable, nurturing relationships and environments for their children and youth. That is California's provision for prevention services to ensure families have the necessary supports. We believe that communities are strengthened when you have strong families. We must value the family structure, all types of families, to make strong communities. I would like to just quote a vision statement that I heard the other day from Asia Schomburg, who's our Associate Commissioner of the Administration for Children and Families. And her vision states that we should have a loving approach to helping children to attain what they need, to live with dignity by comprehensively supporting families through a collaborative network of carefully selected resources and effective public and private investments that is grounded in community and culture and a workforce that is fully devoted to serving with intentional equity. And I think California aligns with that vision very well. Our next slide, please. California has been investing in prevention services for many years, and our state program of prevention services is an opportunity for us to expand upon that work. There's a lot of work that we've already done in California. So on this slide is a list of the various programs of primary and secondary prevention services and supports that are currently available in California. And some of you may not have categorized these as prevention services, but they are. This is a list of starting places where you can build from. You look at your child abuse prevention counselors. I'm wondering how many people really know the role of the CAPCs in their community. Their relationship can be leveraged to be empowered within the county, with the city and the county. They have been around for a number of years, and I think this is a season to elevate child abuse prevention counselors. You have your family resource centers. They have the eyes of the community where they are located. Family resource centers we're hoping we will be able to support and build up more of their infrastructure so that they can keep the kind of services in the community that we need. For these agencies to be able to continue to be able to thrive and to expand other primary prevention and secondary services. You see on here CalWorks. We have a lot of CalWorks programs from linkages, homeless assistance, our home visiting programs, and we just started with our children's systems of care work. Even a lot of the work that started on the back end, we are translating that work to move on the front in the system. Wraparound and building up the Strengthening Families framework. So we have a broad landscape of prevention services that California is already onboarding, and we think that helps FFPSA as only a tool to add to the work that we've already completed in our state. Next slide. So how will California's vision be achieved? Well, it will be achieved by implementing a comprehensive continuum of services. That is going to be the theme you hear throughout this webinar today, making sure that we engage the community, that we understand from the community what prevention looks like in communities, strengthening those primary activities so that we can address the overall health and well-being of children, youth, and families and their communities. And requiring that the service delivery be rooted in the frameworks of equity, threading that equity in all of the elements of system, program, and practice, making sure that our models are holistic, speaking to the whole family, the entire community approaches, just returning back to those things that we know are natural and informing in our communities for our approaches. Next slide, please. So just to remind folks, I know saying primary, secondary, and tertiary is a lot of words in your mouth when you try to say all that really fast. But just briefly to just explain to people, we know that primary prevention activities are those activities that are targeted at the community at large. Those activities are meant to impact families before they have any allegations of abuse and neglect. You typically, when you think about primary prevention, you think about the public awareness, public education activities, those kinds of activities that are open to anyone in the community and they support the families. We find sometimes that, primary prevention can be challenging to measure because you're trying to measure the impact of something before it happens, and it's sort of an unknown variable. But This is a type of activity that we fund in the state under programs that we call our CBCAP programs. Then you have secondary, if you move up the tier. The secondary prevention activities consist of activities that families that have been identified to have had one or more risk factors. It could include families that have substance abuse impact, teen parents, parents with special needs. Looking at services also such as parent education classes, just looking at targeting some of those high-risk families, providing services even as something, for example, like respite care, home visiting programs. So in California, we also invest our federal dollars and CBCAP monies in some of these areas and services and programs. And then at the top is the tertiary prevention. Those are targeted to families where we have confirmed or unconfirmed child abuse and neglect reports. These families have already sort of demonstrated that they need an intervention, whether it's with a court or without court supervision. These are families that qualify for our child welfare protection programs. They tend to not be the focus of some of the CBCAP programs. So I would think that if you're a county and you've never had enough money to support your family maintenance programs, here's another opportunity to think about building up those services and supports to target those populations. So these are the activities along the funding source that could be connected to the comprehensive prevention plan in many diverse ways. Next slide. So we want you to utilize a lens of diversity, equity, and inclusion. And all of the work that we're doing in this space and all the work that I think all programs are doing at the state and local level have begun to look at the work through the lens of equity, diversion, and inclusion. We must thread equity into all areas of our systems at the program and practice level. That work is crucial to benefiting communities of color, and including families that I have to emphasize that experience multi-generational systemic interventions and disproportionate outcomes. So families will be the experts for data sources for building your prevention program, and we have to honor those voices. If we don't honor those voices, we miss the opportunity to represent a plan that does not reflect the perspective of families, all types of families. We must be unified in that aspect so we can avoid family separations, including families of all types. We must recognize that the services have to be culturally responsive, that even though they're not on the well-supported ratings, we are recommending that you feel free to examine and provide those types of services and fund those services to fill the gaps in your community. You must address systemic barriers. Relationships are important as well, and adapting the integrated core practice model that we've been implementing for a number of years to really reflect authentic engagement and partnership. By looking at the community pathway, it allows us to deliver the type of prevention services that we want to deliver, that we feel are very critical on the front end. And we want to make sure that we are not building a governance structure or a system that does not address structural racism. We need to make sure that we are looking at that in terms of, how do we develop strategies to address those areas. So utilizing that lens throughout the work that we do will be crucial in this workspace. And now I will turn it over to Kelly. She will go into more details about the Families First Prevention Services Act.
Hi, good morning. Thank you, Cheryl. My name is Kelly Winston. I'm Chief of the Family Centered Safety and Support Bureau here at CDSS, working with Cheryl and Hillary this morning on FFPSA. So happy to be here. So my role this morning really is to talk about the federal law, FFPSA, and AB153, our state statute, and how those two things work together. So I'm going to start with a review of the federal law. So PL 115-123, or FFPSA, was passed in 28. It had many provisions, and most notably for today, we're going to focus on Part 1, which implements new funds for prevention services. And then, of course, Part 4, which many of you have heard about, restructures requirements for congregate care facilities in California, the short-term residential treatment centers, amongst other provisions. But again, today, we're highlighting Part 1 provisions. So these provisions offer federal Title IV-E funds to be used for specific evidence-based services for families where a child is considered to be at imminent risk for foster care. Previously, states could participate in the Title IV-E Weber demonstration project using funds flexibly for prevention services, but that program ended in 2019, and FFPSA makes use of IV-E funds available under specific conditions that we're going to talk about today. Eligibility for services under Part 1 includes children at imminent risk for foster care. These are candidates with the goal of serving them as well as their family members. That provision about their family members is sort of a first-time thing. It's the opportunity to not just serve the child, but also the members of their family. Part 1 also includes eligibility of pregnant and parenting youth and their children eligible for services that support their specific needs. Eligible services under FFPSA for reimbursement include in-home parenting skills, mental health services, and substance abuse prevention and treatment. Additionally, the federal law enables the ability to evaluate services with the eventual goal of their inclusion in the Federal Prevention Clearinghouse. The goal of Part 1 is, of course, to reduce entries into care by addressing safety threats, which help children to remain in home with their families. Okay, on to California Assembly Bill AB 153, our state law. In California, we passed AB 153, which expands upon FFPSA by offering additional optional funding that requires counties to engage partners in the development of a comprehensive prevention plan. So this will include primary, secondary, and tertiary strategies, in addition to those funded by FFPSA with Title IV-E funds. Development of the comprehensive prevention plan requires collaboration with various community partners, other public agencies, tribes, individuals with lived experience, and other key stakeholders in their communities. The state has realized that government agencies and community partners may be in varying levels of understanding of primary prevention strategies and what it will entail to develop a comprehensive plan using a cross-sector approach. And so this webinar today and the others in the series that you're going to hear about later will be a primer for a way community partners and county agencies can start to think about how their agency may fit into the larger goal of developing a comprehensive plan. And so for those agencies who haven't begun to dive into prevention work, this law supports the ability to start all of that really great work that we're about to do. Okay, next slide, please. So a little bit more detail on AB 153. So AB 153 amends Welfare and Institutions Code, and this is a breakdown of each section. So again, under this new law, requirements reflecting FFPSA were included to enable access for state and federal funds for the development of comprehensive prevention services. Specifically, we added these several code sections for various reasons. WIC section 16585 affirms the state's commitment to implement prevention services to reduce foster care entries and keep families together as a way to reduce disproportionality and ensuring compliance with the Indian Child Welfare Act. WIC section 16586 provides key terms, definitions of key terms that are used throughout the statute, including eligibility for services and the requirements for the services related to Title IV-E reimbursement. WIC section 16587 specifies the requirement for counties to opt into the program by submitting a local plan developed in consultation with relevant entities. And it requires CDSS to consult with Indian tribes on the statewide prevention plan, including those associated allocation policies, procedures for a tribe who operates a Title IV-E program through an agreement with the state. And then this section further provides that Family First prevention services can be offered up to 12 months, including additional or contiguous 12-month periods on a case-by-case basis, as long as the child continues to meet eligibility requirements. 16588 specifies the requirements for the utilization of state and federal funds. And then 16589 explains the CDSS requirements and commitment to the collaboration with the Department of Healthcare Services. Also here today, this will include producing joint guidance on payer of last resort requirements and coordination of Medi-Cal services and payment. Okay, so how do these programs, this federal law and this state law, work together? So we have kind of a smushing of the two laws together in a way that works for California. You know, we really want to start by recognizing that, that this effort isn't starting from scratch. Counties working with the Office of Child Abuse Prevention are building already local capacity for prevention. And so we have those teams in mind as we're starting this work. This is also aimed to support and provide additional funding for their efforts, and it expands opportunities for new jurisdictions to begin to participate in this work. The program, which we're calling Family First Prevention Services, not to be confused with FFPSA, the federal law. This is the way that it was titled in statute, so that's what we're working with. Very similar acronyms there. FFPSA aims to ensure that we have a focused effort on services that help reduce disproportionate representation in child welfare, and it offers services that better meet the cultural needs of those families. The state law requires collaboration across service sectors so that we can ensure community voice and the voice of those who have experience in the child welfare system are informing local plans and the type and delivery of included services. This law goes beyond federal law to serve families and communities as early as possible by allowing for funds to be used in primary and secondary prevention levels, in addition to the tertiary levels allowed by the federal law. In addition, we have access to a community pathway, which is very exciting. This pathway provides local jurisdictions the ability to engage families as early as possible with services delivered in their communities. And in this scenario, the 4E agency is the approver of services and family eligibility only, but the family engagement, intake, service delivery is all offered outside the child welfare system. Next slide, thank you. So the next two slides really continue to identify how the federal and state law are aligned. So to meet federal law, the state's prevention plan includes ensuring a competent, well-trained professional workforce, trauma-informed, and a workforce that engages families and voluntary services. Those services, also trauma-informed, are intended to support families and mitigate future trauma. Title IV-E services will be delivered to candidates determined to be at imminent risk of foster care, and then also, again, those pregnant and parenting youth, as well as their family members. Services are monitored on an ongoing basis through a continuous quality improvement process, which monitors child and family outcomes to ensure that the services selected are effective, and also so that they can plan for program improvements over time. Title IV-E services will be delivered in such a way that that we can ensure that they're in compliance with the Indian Child Welfare Act. The California plan currently also provides access to 10 well-supported EVPs and the evidence-based practices in the federal clearinghouse. Annually, the plan will be reviewed to determine what services may be added or to make other adjustments that are gleaned from our continuous quality improvement efforts. Model fidelity monitoring of each EBP, the services delivered, this ensures the services are delivered as intended, demonstrated by programmatic and administrative indicators. Documentation and data reporting, candidacy determination, prevention plans, required child level data services, and program outcomes are all required to be reported to the federal government. Our comprehensive prevention plans also must use the Title IV-E funds as a payer of last resort, which is unusual. Typically, we see that Medi-Cal is our payer of last resort, and this changes that for these Title IV-E services. And today we'll talk a little bit later about anticipated joint guidance for working with local behavioral health and mental health plans to deliver services in conjunction with Medi-Cal payments. And then finally, I think I skipped this bullet because it's a little bit duplicative of the first slide, but it does bear repeating. While much of the federal requirements enacted in both state and federal law are for Title IV-E services, and they have a lot of requirements that go with them, the way that we're delivering this in California is to expand to ensure that we can include those very important primary and secondary services. And with that, I'm going to pass it over to Hillary, who's taking on our next set of slides.
Hi, good morning. I'm Hillary Conrad, the Bureau Chief for the Office of Child Abuse Prevention, and one of the team members that are planning FFPSA Part 1 planning and implementation. Today, you've heard about the plan that the state has developed. You've heard about the law that has been enacted to expand upon the federal law. And you haven't really heard about how do we put this all into action. So the state has come up with a roadmap to develop what we're calling a comprehensive prevention plan, which is how your local Family First Prevention Services program will be put into action. So we have a graphic that I'm going to go through to explain to you what the process and journey will look like for collaborative partners to develop their local level comprehensive plan and Family First Prevention Services program. As well, I'm also going to talk to you about the support that you can expect from the state along the way. Next slide, please. Okay, so what we have done is we have put together a graphic to basically recognize that counties and their collaborative partners are going to be at varying phases of readiness. And in the center of this graphic, you'll see that the arrow indicates those on the left that, as we had talked about earlier from Jess's poll, are just starting their primary prevention road trip. And then those on the right are already getting closer to their destination or have at least started mapping it out. And you'll see at the bottom, we have 4 different phases, and these different phases represent different steps and decisions that counties and their collaborative partners will walk through. And then on top, we have what we call lollipops or bubbles to indicate some key milestones that are in red, as well as other key decision points that are in black. What I want to point out for an example is the guidance and information phase. It started with the release of the State Block Grant letter, which you've heard referenced throughout this presentation, but it really doesn't have necessarily an end. It's really going to depend on the county and the collaborative partners. So for example, in this phase, this is when you're learning more about FFPSA Part 1, AB153, you're learning about the levels of prevention, you're learning about how to reimagine prevention and move upstream. So in this phase, you're really gathering more and learning more, but there's no end to it. You could receive all the information through the Reimagining Prevention webinar series, hear about the Community Engagement Toolkit from Junius Williams, but we're not saying that that's where you have to stop. There could be additional questions and more information that you're interested in, and the state is here to support you and provide that information to you. What I'm going to talk about in the next 2 slides is a drill down of our capacity building phase and the readiness building phase, as well as the tools that we have to support those 2 phases as counties and their collaborative partners walk through those phases. Next slide, please. Okay, so in this phase, this is the capacity building phase, and you'll notice that you have 2 bubbles or lollipops that are in red. The capacity assessment is the tool to start thinking about who is involved already in prevention planning efforts. What other partners would you like to bring to the table? Think about what other processes are already in place in regards to shared leadership, community engagement, making sure that you're also thinking about equity. So this is a tool that's going to help you decide where you are at across this entire readiness continuum and where you may want to start. It's also a key, what we want to think about as your pre-planning work. This is where you're looking at data, you're engaging with your community, you're starting to think about what might be the appropriate services or strategies to implement that are most effective for your community and the populations that you're serving. And then finally, this is also when we consider that counties and their collaborative partners will consider opting in. It doesn't have to happen in this particular order, but it just, the opting in will allow you to have access to that state block grant funding that has been referenced earlier in the presentation. Next slide, please. So what is the capacity assessment tool? The capacity assessment tool is about 25 different statements across 4 areas: motivation for change, provider capacity and capability, system capacity and capability, and policy supports. And counties and their collaborative partners can rate themselves as whether that particular activity or whether that statement already exists, whether it's absent, emerging, or established. And if they rate themselves as absent or emerging, that's an area that they would want to identify action steps as how to support those particular areas before they move forward. The capacity assessment is a way to really focus on what relationships have already been built and what relationships need to be built in order to be successful in the complete comprehensive planning and delivery of prevention services. Next slide, please. Okay, now you've done your capacity assessment, you've done a lot of pre-work, you've gathered information about the prevention services that already exist, you've looked at the populations that are being served. Now you'd move into what we would call the readiness building phase. And in the readiness building phase, similar to the capacity building phase, there's also a tool to support that effort and to identify gaps. This is also where you're making final decisions. So in this phase, you've either drafted your plan or you're starting to draft your plan. So you're thinking about which evidence-based practices and who are the candidates that you'll be serving. And then you're thinking about, once you have drafted the plan, what are going to be the steps that you put in place in order to implement and deliver those services. Next slide, please. So the readiness assessment tool has different domains compared to the capacity assessment. And these domains are focused on more of the implementation side, the different components that you'll want to make sure that are in place prior to delivering your services. And this is also similar to the capacity assessment and format, as it has items that are listed or description of activities for you to identify which tasks you have not completed. So for example, one of them is establishing a governance structure. So if that's something that you've identified that you have not done yet, that would be somewhere that the state and other entities could offer you support. Another example is that you have made sure that all of the partners that should be at the table are included in the process and that you've engaged your stakeholders. If that's something that hadn't happened, then that was something that you would want to step back and that the state and other consultants could support you on. Both of these tools, the capacity assessment tool and the readiness assessment tool, are meant to be a support to help you know whether or not you're ready to move to the next step. Next slide, please. Okay, so as you're walking through the process, you've completed the capacity assessment, you completed the readiness assessment. What is the end goal of all of this? The end goal is that you want to develop a comprehensive prevention plan, and not only a comprehensive prevention plan from the county's perspective, but from the county and the collaborative partners' perspective, and making sure that you're infusing equity along the way. So within the block grant letter, we have a list of what are the comprehensive prevention plan components. And this slide shows the list of those components. You'll notice that there's a linkage between the areas that are in the capacity assessment as well as the areas that are in the readiness assessment. So for example, in the capacity assessment, one of the things that you're thinking about or assessing yourself on is has there been an asset map completed or a needs assessment of prevention services that already exist. So that particular component aligns up with the capacity assessment of something that you would want to complete. Another example is the spending plan. Within the readiness assessment, you'll notice that there was a domain for funding and fiscal models. So if you have worked through what those funding and fiscal models are prior to finishing your plan, you'll have an appropriate and reasonable spending plan. So you'll see that each piece on the roadmap is connected to the next piece, creating a through line that in the end, you're going to develop a successful comprehensive prevention plan, as well as implement a successful Family First Prevention Services program at the local level. Next slide, please. And with that, I'm going to toss it over to Dina Cocos Gonzalez with DHCS, who's going to speak to the importance of collaboration between behavioral health and child welfare.
Thank you so much, Hillary. Appreciate that. Good morning, everybody. Dina Cocos Gonzalez from the Department of Healthcare Services with the behavioral health area. And I'm just going to speak briefly to emphasize the importance of local coordination of behavioral health and child welfare when we're talking about the process of selecting EBPs and so forth. So as mentioned, comprehensive prevention planning requires early engagement in the cross-sector planning and collaboration, and engagement of the mental health plans, the MHPs, is really critical for the Family First Prevention Services program, starting with the opt-in decision process. MHPs do play a special role in it, specifically as it relates to care coordination for Medi-Cal eligible beneficiaries when a behavioral health service is indicated. Consultation with the mental health plans is required before the Family First Prevention Services letter of intent and the local comprehensive prevention plan is submitted. And the mental health plan's input regarding the 4E agency selections of EBP is necessary when the EBPs include services that are administered by the local behavioral health agency. And Title 4E agency, next slide, please. Title 4E agencies that elect to provide Family First Prevention Services program prevention services will need to establish a joint written protocol based on the Department of Social Services and Healthcare Services model joint written protocol, which has not yet been distributed, but will be sometime in the summer, and there'll be more information coming on that. And the protocol is really about establishing, which system program is responsible for payment in part or whole for a prevention service. And like the systems of care approach, child welfare agency, probation departments, behavioral health agencies, and other appropriate entities really need to use the protocol and determine and coordinate who will be responsible to pay for the prevention services. So more to come about the 4E being the payer of last resort. But of course, there's some really critical components when we talk about MHP involvement. Care coordination is really key, so that we're coordinating services that are being provided to Medi-Cal eligible children who are receiving specialty mental health and mental health services, and also making sure that we are appropriately maximizing Medicaid here in California, Medi-Cal federal dollars whenever appropriate and available. And we know that so many of the EBPs have components that are eligible for the most part when meeting the federal requirements for Medicaid as a Medicaid service. And so we would want to maximize those federal dollars on the Medicaid side, being that Title IV-E is a payer of last resort. So again, the coordination between the behavioral health system and child welfare is really critical, all the way from the opt-in, letter of intent opting in, to the selection of the EBPs from the joint protocol. So just wanted to highlight that and make sure that that is really clear. And again, as we move forward with so many of the initiatives, really looking at things from a systems of care approach is really critical. And this FFPS program in part 1 is no different in that really it will benefit from a system of care approach. With that, I'm going to pass it over to Kelly.
Thank you, Dina. So talking a little bit here about submission dates for our letter of intent and for the comprehensive prevention plan in order to opt into FFPS. So counties can opt in to this program in one of two ways. First is our letter of intent. So statutorily, counties are able to opt in early to receive their state block grant funds by submitting a letter of intent, which is due to CDSS on April 30th of 2022. It's important to note that the letter of intent is really intended to let us know that they're starting to plan and explore their ability to provide these services. But if at a later date they choose not to opt into the program, it doesn't commit them to a full 3 years of participation. It's really that ability for counties to be able to take a look at their system, do the assessments necessary for determining their capacity for services and their capacity for readiness to serve, and to build that collaboration and develop those teams to help develop those prevention plans. So that's our early opt-in process, gives access to the money earlier than if you wait to submit your comprehensive prevention plan. And then of course, the second way is to go ahead and submit your comprehensive prevention plan. Those can be sent to CDSS as soon as you're ready to send them, but no later than January 31st of 2023. This is so that counties can take optimal use of the time that the block grant funds are available, which is of course that 3-year period. So again, April 30th for the letter of intent, January 31st, 2023 for the comprehensive prevention plan. And I think Hillary is the next slide.
Okay. I just want to highlight some key points to keep in mind during the prevention planning and implementation process. We mentioned two tools, the capacity assessment and readiness assessment. The capacity assessment is already available online and can be accessed through the state block grant letter, and the readiness assessment will also be placed online as well. And those tools are really there to help you identify which areas that we can provide you support, as well as coming up with a plan of action to address those areas that are considered gaps. I also want to mention that this is not just a Title IV-E and block grant funding plan. This is an opportunity for you to leverage funding from other sources across different service sectors, to think about the array of federal, state, and local funding. The spending plan, which is one of the components of the plan, is going to include other funding sources that can be leveraged to support a continuum of services, including primary prevention strategies. I want to mention also that you want to think strategically about who you have at the table. Make sure that you're thinking about those with lived experience, as well as tribal partners, at minimum, probation, behavioral mental health, Office of Education, FRCs, and CAPCs, and making sure that you're thinking about the populations that are disproportionately represented in child welfare and other family serving systems. And then I also want to say, don't start from scratch. We've given you a lot of information, and think about other initiatives, efforts, and other processes in place that can support these planning and implementation efforts. Next slide, please. So for example, some of the initiatives that can be leveraged are AB 2083 that was referenced earlier as system of care, and then also OCAP prevention planning teams, which started about 3 years ago. And Strategies TA, who is here on this call, have supported that effort. So thank you for that. Both of these efforts can be utilized as a starting point. AB 2083 requires that counties establish a cross-sector team, which could potentially be utilized as advisory committees to help develop the plan. AB 2083 also requires counties develop an MOU to share information and data. This MOU can be amended to include prevention partners. OCAP prevention planning teams can also be leveraged as advisory committees for comprehensive prevention planning, along with the asset mapping work that has been completed and the expansion of prevention strategy development to include primary, secondary, and tertiary. I've spoke about the comprehensive planning process and the roadmap that the state has put together as a vision and the components of the plan. Now we're going to hear from Kelly Kay and Cyrus from CDSS about the funding that is available and referenced in the ACL to support this effort.
Good morning. My name is Cyrus Sanchez. I'm an analyst in the Children and Adult Programs Allocation Unit at the Department of Social Services. I'll be providing an overview of the State Block Grant General Fund allocation. Counties can view their allocations in County Fiscal Letter 21/22-84 on the CDSS letter site. Approximately $198 million general fund has been distributed statewide. This is a one-time allocation and is available for expenditure through June 30th of 2024. On that note, I'm going to pass this off to my colleague, Kelly Kaczynski.
Good morning, everybody. Thank you for having me. My name is Kelly Kaczynski, and I'm a manager in the Children's Unit of Fiscal Policy. And just a brief overview of the fiscal requirements. So number one, when can counties begin to claim their state block grant funds? Counties can begin to claim retroactively back to October 1st, 2021, provided that they've tracked actual time spent on these activities. Allowable activities for the state block grant and for 4E were outlined in ACL 22-23 on pages 11 and 12. To access the state block grant funding, counties must submit the LOI, the letter of intent, and the CPP, the Comprehensive Prevention Plan, as outlined in ACL 2223. More information is going to be provided between the different program codes and to distinguish between the activities in the state block grant and Title IV administrative costs in a forthcoming CFL. But it's important to note that the preventative services provided directly to the youth and families will be paid using state block grant funding. It will not be eligible to be paid for using the Title IV costs until we have child-specific tracking of outcomes, which will be tracked in the CARES system. So when CARES goes live, then we will be providing more information about how to draw down Title IV for those activities. But until that time, the preventative services will only be paid using state block grant funding. 4E funding requirements and how to get reimbursed. Counties will be using the standard operating procedures. They're going to be claiming their time using program codes and PINs and will submit the costs through CCRIS. We're going to be utilizing the exact same claiming mechanisms, no change to the general claiming procedures or the way that costs are allocated. So again, the differences between the state block grant and FFPSA, the Title IV preventative services and those activities will be laid out in a forthcoming CFL. Thank you. I'm going to pass this back to Kelly, please.
Okay, so I just kind of want to remind folks to the slide we saw at the beginning that looked like a pyramid that identified all of the elements and activities for the primary, secondary, and tertiary services. It is helpful. This is a rectangle, but it really is kind of reflective of that pyramid. And it demonstrates which funds can be used for which tier of prevention activity. So we just heard a lot about the general block grant, the general fund block grant. So again, that's $222 million of general fund that is available over 3 years to implement all 3 tiers of prevention services. And that's that rectangle in the middle there. We also have in the upper left corner, the American Rescue Plan Act of 2021 gave us the ARPA CBCAP funds. These funds can be spent on primary and secondary services. This is a supplemental grant that can be used, again, on primary, secondary, community-based prevention programs and activities which advance racial equity in supporting underserved populations. This, of course, is a one-time allocation. It must be obligated by September 30th of 2025 and spent by December 30th of 2025. And then Title IV-E, Kelly also talked about Title IV-E's funds for the prevention services program. These can be spent mostly on tertiary, some secondary programs, as long as they meet federal requirements. FFPSA allows for ongoing Title IV-E funding to support those evidence-based prevention services to prevent families who are at risk of entering care from actually entering the foster care system. Claiming of Title IV-E services can occur once the state's prevention program or plan is approved by the Administration of Children and Families, and the state has the ability to meet all of those federal requirements for the program. But local jurisdictions will be able to claim admin funding for eligible activities once they have opted into the program, either via the letter of intent, again, due April 30th, or by submitting their comprehensive prevention plan, again, due January 31st of 2023. And then at the bottom there, we have the Family First Transition Act funds. So this was a federal grant that states received, and California received about $49 million in transition grants intended to support implementation of FFPSA and transition away from the Title IV-E demonstration project. So those funds were allocated in spring of 2021, and every county was given an opportunity to access those funds with a minimum of about 100,000 going to each county. We asked that counties use at least 50% of their FFTA allocation for prevention and early intervention planning, expanding capacity for evidence-based practices, And for any other FFPSA evaluation activities or transition activities, particularly for those former waiver demonstration project counties, so that they could sustain programs developed under the waiver and transfer those over to FFPSA prevention services. FFTA funds will be available through September 30th of 2025. And again, these can be spent on primary, secondary, and tertiary prevention activities. Okay, the next slide. So recognizing that this slide is a little bit difficult to read, it has a lot of information, really small type, but we're going to drop it, I think, in the chat so that you can use it, and it should be available as a handout. This is another way of looking at those funds. It gives a little bit more detail about how they can be used, what the sources were that they come from, and for future awareness, we will be developing a toolkit for counties who are opting into the program, which is more of a 3-page version of this document that has an overview of all the existing funds that child welfare agencies have access to for prevention services. So this will be a nice tool that counties have available as they're planning their budget for their prevention services program. Today's presentation only includes these 4 funding sources that I just walked through a few minutes ago. But in addition to that, there are additional CAPTA and CBCAP federal funds that we get on an annual basis that can be leveraged for use of supporting the FFPSA program. We also encourage system partnerships so that we can leverage other prevention resources available to other partnerships. These are, for example, the Mental Health Services Act, which also has a prevention focus for parents, First 5 funds, and a myriad of other local partner resources. And then, we've also heard, although we don't know specifics for sure, we've heard that there may be additional prevention funds in the current president's budget upcoming. So something to keep an eye on when we're thinking about supporting this program. And I think that I'm going to pass it to Hillary for the next section of the program. Oh. That is not correct. I have one more slide. So some of you may be wondering about data and automation and how we're going to collect all of that information. So obviously FFPSA requires a fair amount of data collection that from all states in order to claim 4E for these prevention services. This includes child-specific expenditure data amongst other program and outcome information. And Kelly Kuczynski talked a little bit about how we're going to be using CARES to collect that information because our current system is rather old. CWS-CMS, if you're familiar with it, it has been in use for many years and is no longer capable of capturing such information, particularly those fiscal aspects. So because we're in the process of already developing a new system to replace CWS-CMS, to meet these needs, we intend to use CARES and include Family First Prevention Services in the development of that automation. And this is expected to streamline data entry for all case managers and potentially service providers to facilitate both ease of reporting, both at the local and the state level, and then also to give us that opportunity for continuous quality improvement and make program improvements over time. And now I'm going to pass it to Hillary, who is the next section.
Thanks, Kelly. Okay, we've told you a lot today. You've heard a lot of information about the law, about the planning process, about the funding, and we're here to partner with you. We're here to help. We are developing a technical assistance program, and we want to start with saying, as of right now, with the information that you received today, as well as after looking at the block grant letter, you can reach out to us and we will contact you and we will set up time to meet with you. I would also suggest if you want to go ahead and complete the capacity assessment, that's another start to begin the planning process. But we are here to support you. So please feel free to email the FFPSA mailbox. I believe Jessica is going to drop it in the chat, or reach out to a CDSS consultant. And next slide, please. Some of the other guidance and upcoming support and tools that are coming your way. We already released the ACL that's been referenced several times throughout this presentation, as well as there's also the FFPSA website that you can access information about the federal law also. And then we understand that part of this planning process is going to include looking at data across different service sectors. So a data playbook that we partner with Safe and Sound is going to be released in mid-April. And that playbook is a how-to guide of how to use cross-sector data in order to engage your community, look at equity, as well as to make decisions about prevention strategies and services to implement in your particular county. In addition to the data playbook being released in mid-April, there will also be accompanying webinars where we will go over the data playbook. And then finally, we are putting together in partnership with Strategies TA a comprehensive planning toolkit that will have tips and tricks and best practices on how to be successful in your planning and implementation process. And I had talked about the different components of the final comprehensive prevention plan. Those will also be defined within a template as a guide for counties to develop their final plan. And with that, I am going to pass it to Cheryl, who is going to announce our Q&A session.
All right, we have thrown a lot of information at you. I hope that there have been some takeaways and that we've been able to resolve some of the unknown questions that you've had in your mind about this process since we issued the letter. So now as we go into Q&A, I'll ask Randy to select questions for us to respond to at this time.
Hi, good morning, everyone. My name is Franny Desai. I work with the Office of Child Abuse Prevention. And yes, we do have several questions. One of the first questions we wanted to share is just to clarify, Title IV-E cannot be claimed until ACF approves the California's prevention plan and when CARES is available. If Kelly or Cheryl would like to answer any of that, or our fiscal.
So that is a bit of a tricky question, but the answer is technically yes, that's true. We do have to have an approved prevention plan, and we do have to have a way for reporting data. However, ACF has been really flexible in allowing us to do some claiming back. And Kelly Kuczynski earlier had talked about, if there are counties who can track data, they will be able to do back claiming back to October 1st, which is when we were able to meet all of the requirements for Part 4 of FFPSA. And so that's the date at which claiming can begin to occur. Now, having said that, services are more challenging to be able to claim at this point because of the automation elements and those fiscal requirements that that currently we don't have the ability to claim because CWS CMS doesn't capture that. But those admin services are something that counties can track. They can really claim admin dollars for planning activities, evaluation. If they're looking to evaluate a program that they're running, there's a number of admin activities that they can begin to do right now. And the trigger for the state is really to submit that letter of intent or a comprehensive prevention plan.
Thank you, Kelly. Another question. There's some language that Medi-Cal is also the payer of last resort for various services. Will there be guidance on when or who is the payer of last resort for counties? And if our fiscal folks can just shout out, that would be great.
Can you repeat that question again, Franny?
Sure. Will there be guidance on when or who is the payer of last resort for county?
Yeah, I think we alluded to that earlier in the presentation, that we would issue that guidance jointly once we work through some of the details of, how some of the EBPs can be, some of the funding can be allocated for payer of last resort when it comes to the EBP. So there will be guidance, and that is something that we're working on with Department of Healthcare Services.
Thank you, Cheryl. I know there are a few questions on payer of last resort. So just as a reminder, as Cheryl said, there will be guidance coming up. Given we need to use state block grant until CARES goes live, after CARES is up and running, can jurisdictions retroactively claim 4E funding?
Yes, I think I answered that just a couple of minutes ago with the concept of counties will be able to claim back as long as they can track their data. They'll be able to claim back to October 1st of 2021, which is when we were able to complete our requirements for Part 1, which was a condition of opting into Part 4. We were able to meet our requirements of Part 4, which was conditional for opting into Part 1.
Kelly, this is Elisa. I just wanted to add that if this was a question about services costs, I believe that we are under the impression that you would not be able to retroactively claim 4E for services costs until even after CARES goes live. That would only be prospective. Is that your understanding as well?
Yes, but admin costs can be claimed.
I know that there were several questions that we answered ourselves in the chat, but we wanted to make sure that everyone was able to get the same information. So just in case, how do you access the 10 EBPs? So we did put in the 10 EBPs can be found in our California State Plan on pages 34 through 38. And I believe that is in the chat, and that's Appendix 8. There was another question asking, there are more than 10 EBPs in the clearinghouse. However, we are just focused right now on the 10 EBPs that were selected that are in the state plan as is written currently. Another question is, can you say more a little bit about model fidelity and EBPs? We will be providing further guidance regarding model fidelity and EBPs in the future. We also are going to be creating, someone asked about a comprehensive prevention plan template. Yes, there will be resources and guidance also around a comprehensive prevention plan template. This template is just as a resource to share with counties. You're welcome to use it. You're welcome to do your own type of comprehensive prevention plan template if you choose to do so. But we are working on that guidance and those resources for you.
So Franny, just to add a little bit regarding the question on model fidelity. So we're working on a process where model fidelity oversight will be completed both at the local level and the state level. We'll be seeking contracted services to help coordinate statewide model fidelity oversight and support. So not only will counties be taking a look at that, those activities to ensure that we're meeting those federal requirements for the 4E services, but the state will play a role in helping to provide technical assistance, coaching for counties that or service providers that want that assistance, and more guidance will be coming out on that process, and probably more like summer as well.
Thank you, Kelly. Also, I just wanted to take note in the chat, Jess A.S. has kindly put in there, if you have any CARES automated related questions, please, you can email her at comms@cwds.ca.gov. And I know we have several CARES questions, so please feel free to email directly to that inbox. Another question came up is any links to capacity assessment and readiness assessment. And just to let you know, folks, that the capacity assessment, the link is within the ACL State Block Grant that was released for the capacity assessment. We are still working on the readiness assessment. There is information about the readiness assessment and basically a summary of kind of the elements of that readiness assessment. However, we are still developing the readiness assessment, and we hope to be sharing that shortly as well. And that will be similar to the capacity assessment in format and style. And there's a lot of questions about resources and guidance. One example here is, will guidance and methodologies be made available for how project target population numbers? We are sharing as much resources as we can with counties. We're developing a process in which we can share resources. And as mentioned, we have also a technical assistance system up and running or starting to get into place so that we can support you in that. And one question for the team is the opt-in cycle every 3 years? Someone can clarify that question.
So right now we're saying that the comprehensive prevention plan that counties are required to submit is a 3-year plan. We anticipate that there will likely be another 3-year version or some semblance of that, but we haven't made any decisions about the length of time for the next iteration. So right now, that's what we know. A 3-year plan is what they'll be developing for now.
Thank you, Kelly. Several of these funding sources have end dates. How do the services continue after the funding has stopped?
So I'm going to answer that question because I spoke to some of the funding sources that we have available in the slide or in one of the slides that I talked about. So if you want to reference back to those funding charts that we talked about, not only are we looking at the 4 new services or resources available for counties, but there are a myriad of other funding sources available for prevention. We are coming out with a handout on what all of those are to help counties think about how they can look a little bit differently at their budgeting process, to blend and braid different resources that not only child welfare and probation agencies have access to, but also to partner with other system partners and leverage some of those other funding sources. And I think I used like the Mental Health Services Act and First 5 as some examples of that. There may be others that I didn't include in that process. And those are that's kind of the known information for now. And then I think this bears repeating. We did kind of get a public notification earlier this week that there's consideration of inclusion for additional funding for prevention services in the federal budget. So that's a potential thing that could happen. And then of course, there's always the state budget, which is an additional unknown. But right now we're trying to focus on the things that we do know so that we can help support continuity. And then we've asked counties to talk to us a little bit about what are the barriers for sustainability. And we want to be able to hear those conversations so that we can do our best to support the program over time.
Thank you, Kelly. Will counties be responsible for building their own tracking systems or database to claim FFPSA related services until CWS Cares is fully developed?
So our goal is to avoid that. I think there's a lot of, and just put in the chat, we have a lot of federal requirements about having one system, and it gets tricky when we start adding a bunch of different systems in there. So our intention is really to make CARES our single automation point, and that's the status of that thinking right now.
And finally, if counties do not opt in right now, can they do so later?
So counties can opt in. And we just want to remind folks, this is a 3-year block grant, right? So there's limited time to spend $222 million. So counties can opt in as early as possible with their letter of intent. And we really do encourage that because it gives that availability for exploration without like a long-term commitment. And counties will not be required to pay back money that they spend if they choose not to continue to participate. The ultimate opt-in is by submitting your comprehensive prevention plan in order to ensure that we utilize the funding available we ask that counties submit their plans by January 31st of 2023. That gives them an additional year and a half to spend that $222 million. And we want to demonstrate that we can effectively utilize those funds. And so we wanted to balance kind of the need for getting ready with the time frame for expenditure of services.
Thank you, Kelly.
Great.
And
Thank you,
I know
Frenny.
that
Are those all of the questions that we had for the Q&A section, Frenny?
looks like it. I think there's a couple still rolling in. Oh, yeah, there's a few more rolling in as we're speaking. Are there any stats on the number of counties that have opted in to the state? Well, the State Block Grant letter is due April 30th. And so I don't know if there's any current stats on the number of counties so far. Any final questions, folks? Oh, I think there's a question about the exact amount of the state block grant. Is it 222 million or 198 million statewide? I think the question is asking how much did the state receive and how much are the counties receiving? I could be mistaken, but that's how I'm interpreting.
No, that's correct. There's 198 million that goes to the counties, and then the balance of that is retained for tribes and for our state level administration of some of the block grant activities.
I can see several questions about the CBCAP ARPA funds, and we can post that information into the chat, the ACL, so I can give some further information, allocation letter, as well as the ACL describes the CBCAP ARPA and the allowable activities. So put that in the chat. I think we have most of those questions answered. I know that there's some logistical questions here about information. There will be follow-up information. I think the questions here is about, will some of these questions be shared in a follow-up email? So I will ask our logistics folks to respond.
Sure. So one of the great reasons that all of these have been captured in the Q&A is so that they can be documented, right? So thank you to those that submitted your questions through the Q&A feature that will allow us to capture, to compile. And here's also the good news. This Q&A is just a snippet. There'll actually be a dedicated Q&A session to collect many more questions that hopefully you leave in the survey that you report today in the Q&A feature, and I'll be talking about that in just a moment. Franny, thank you for facilitating that, and thank you to the presenters for responding. So what I'd like to do in true Caltrin fashion, we'd like to do just a small activity before we close out. This is a word cloud. Has anyone ever heard of word cloud? It's kind of fun. It's like a word collage, if you will. So what you're going to do is you're either going to take your phone out and scan that QR code, or you can click the link in the chat and answer a question in 1 or 2 sentences, really the least amount of words, the better for the word cloud. What is something you're looking forward to in the comprehensive prevention planning process? What's something that you're looking forward to? I'll give you a second to think about that and enter. And I see, ooh, we are populating some words. So let me do this. I'm going to stop my share. Don't forget to grab that link if you can so that I can share it here in a second. Okay, I see a lot of words coming through. This looks great. Wonderful. Okay, let me stop my share and show you what the results are from your words. What are you saying about it? Let me pull this up. Prepare to be amazed. This is actually kind of fun. It's a great website here. Let's see, here it is. I hope you can see that. So this word collage, the more that a word is utilized, the larger it'll become on the screen. So as you can see here, the word collaboration wasn't randomly selected. It's what is being utilized the most from what you're entering. So it looks like innovation, creativity, change, community healing, collective impact. Look at all these wonderful words. I'd love to put it together and send it out as part of a resource for you and just like a good reminder of what we're doing here. Wonderful. Look at all these great words. Expansion, working together. An exciting thing for me to know from behind the scenes is that a lot of these different words and what you're most excited about will be covered in these curated topics that are coming up. So let me share with you a little bit about what you can look forward to and what you can expect. So excited to see. Thank you for your participation on that. Let me just reshare my screen here. And here we go. Okay. So there's a couple of really important events coming up in this Reimagining series. I actually have one more that I'll make sure to mention. You'll know that there's one that's been separated from the series and it's up top in bold. This is different because it's a very specific Q&A session that is centered around our topic today, the comprehensive prevention planning. Any question that's left in the survey, anything that needs no stone unturned, right, in the Q&A box, we'll make sure to collect those and go through a Q&A session very, very specific about what we spoke about today. Here's some good news. You can register for that now and attend. So I am going to drop into the chat as we are speaking here, just a little registration link. So if you click this registration link, you'll be able to attend that Q&A session, and I hope that you do. There are some more things to note. There's a clinic focused on technical assistance on May 19th as well. It'll be in the afternoon. Link to follow for that session as well. That is not listed on this screen. What you'll also see on here is on April 19th. I personally am very excited about this because I will be facilitating this conversation. It's about exploring a prevention mindset. It'll be followed by leading through change, cultivating commitment. I hope to see you there. If you are wondering, like, Jess, where would I find how to get there? I would love to attend. And I would say, thank you. I'm so excited for that. You can absolutely find that information online now in two different places. The previous webinars and all of the future webinars to come can either be found on the Caltrin website. You click that little link, it'll take you there with all the registrations and resources, as well as the Strategies TA website. Click either one, save them to your favorites, and make sure to join us for all of the future series and what that looks like. Now, before we go to the next slide, because I know that the minute there is a thank you for being here slide, people log off. Before you do, I want you to know that this is very important. It's about the survey. Like I said in the beginning, it's not your traditional survey. Yes, it will ask you about your experience today, but most importantly, it's to temperature check your understanding, your what topics might need to be further explored in the future, your feedback. This is how you can communicate directly with the creators and presenters of this webinar series. So please take the time to do that. It is important. It's hard to meet needs when you don't know what the needs are, right? So I'm dropping it right into the chat right now for the survey and the feedback form. Please ensure to select that. And very lastly, before we go to the next slide, I want to remind you that April is Child Abuse Prevention Month. A lot of important things happening there. And there is a website that has been put together for you, which I'm now going to talk about. So let me advance to the next thing. The CAP month begins in April. It's a webinar series hosted by CDSS OCAP in partnership with the Child Abuse Prevention Center. So I have dropped that link in there for you because it is important that you are aware of where they are, when they are, and all the great things. This page will be shared. The links in this page will be shared with you in your follow-up email that will come in 3 days. That is your registration email. So whatever email you use to register for this event today, that is where you'll receive your email. And with that, I want to say thank you for your time, your participation and attendance. I want to say thank you to the presenters today. Thank you for being with us. And we look so forward to seeing you in the next webinar series. Thank you and have a great afternoon.